Real upset stomach feeling almost constantly. Couldn't sleep very well at all at night. I use a push mower on part of the yard. You know, I'd get half done. I have to turn the mower off and rest for a while and then go finish because I just didn't feel good. Didn't feel good at all.
He had presented to me with really typical symptoms of something going on intra-abdominally, so inside the belly. He had a lot of symptoms of nausea and abdominal discomfort that was triggered by meals.
Went through a number of different tests. Finally, Dr. Kramer ordered a cardiac echo, and that's when the problems were, that's when we found out.
Despite the fact he really didn't have anything typical of an underlying heart condition, that's something that was kind of in the back of my mind as a possibility for him. And that really led to further testing focused directly at his heart.
That cardiac echo showed my heart function. There's a factor, the ejection fraction, and it showed me at a level of about 17, with normal being about 70, and anything below 15, you're in trouble. Your heart isn't working very well at all.
The debate was how to try to optimize his heart function and how to improve on anything before he went in for this huge procedure, which was basically an extensive bypass procedure, which is a many-hour surgery, and individuals who have an ejection fraction that's that low and are already compromised, it's a high-risk procedure.
They had to do a mitral valve repair where they had to put in a metal ring to reshape it, and 4 bypasses. And the cardiologist, when he said, if you would have ever had a heart attack, he said that would have been it. You would have just gone to the ground and been dead. He said I was very lucky.
He wanted to get better and get better fast. He'd had quite a complicated hospital course, and before that, quite a complicated and difficult to diagnose illness.
He previously had been quite active, so he was very interested in getting back to how he had been prior to his illness.
The girls, they seem so nice, but I think either one of them could have been a drill instructor in the military. They have a very nice way of making you do things that you really don't feel like doing. But they also impress upon you how important it is that you do it.
Well, he really exceeded our expectations with his ability to recover from this, and a lot of that's simply because of his perseverance and his ability to stay with the rehab program and to really push himself and to listen to the rehab folks. And he definitely outperformed what I anticipated he would with respect to recovery of his heart function.
Dr. Kramer wanted to make sure I wasn't having any heartbeat issues, and they have a unit that you wear it for 48 hours so they can see what's going on, not only when you're awake, but during the night when you're asleep, what your heart's doing. I started going to the facility at the hospital, the health club that they have there, my thinking being that if I was going to have a problem, I was eliminating the need for an ambulance. I'm already at the hospital.
I happened to look at the telemetry rhythm, and it was VTAC, which is a very unhealthy rhythm. Most people that are in VTAC are, flat on the floor at that point. It means that the ventricles of the heart that pump the blood into the body are not working.
He had some very serious runs of abnormal beats and contractions that, if they persist, if they don't revert back to a normal contraction pattern, can be fatal, can be life-ending. he basically ended up going right from cardiac rehab back up to Madison, where we were able to get him on the appropriate medications and do the monitoring while they were titrated upwards, and he did very well. He didn't require a pacemaker, but that's kind of the fallback in situations where medication doesn't work.
And from there, we pushed him a little further, a little further, a little further. And the great thing about Joe was he was so determined and so focused. He had a plan.
He just became a new man, and he was very excited, and I think he started seeing improvements, and they were following him with echoes to see how his ejection fraction improved, and it was improving, and I think that really excited him, and it excited us. And we were like, wow, we don't usually see this, such a great improvement.
But if Becky and Marianne hadn't gotten me exercising to make it part of my life, the joke was, well, how long am I going to have to do this? And, well, the rest of your life, maybe longer. But I really want to thank them for getting me going and keeping me going and making me able to keep myself going. They're two very special ladies.